Well, good afternoon. I want to speak to you directly about the evolving situation as it relates to the Omicron variant. All over the world, we see increasing impact of this new variant. While there remains much we still don't know about Omicron, there's one indisputable fact. The Omicron variant is the most contagious, the most transmissible variant of this virus that we've ever seen so far. Omicron is now on the verge of becoming the dominant strain of COVID in Ontario. In fact, it may already be. But let me be clear, just because this new enemy is on the offense does not mean we can sit back and play defense. We cannot, and we will not. We will meet this new enemy with full force, because right now, the best defense is a lightning fast offense. And that is what we're doing right now. We will go after this variant with everything we have. And this will require everyone, every member of Team Ontario, to stand tall and get in the fight. I'm issuing a call to arms. Hospitals, public health units, doctors, nurses, dentists, paramedics, businesses, union workers, first responders, and most importantly, you. Everyone has a role to play in the next phase of our provincial COVID response. It's all hands on deck. And it starts with booster shots. Nothing matters more than getting these third shots into arms. To that effect, we're urgently expanding eligibility. As of Monday, everyone 18 years of old and older will be eligible to get their booster shot 3 months after their second dose. That means those over 50, please, I urge you, take advantage of the next few days. You're at the most risk. Use the portal, call the number, call the pharmacies, book that appointment now, please. I'm going to give you the number. The number is 1-833-943-3900. That is 1-833-943-3900. At the same time, we're significantly scaling up capacity to do as many as 200,000 to 300,000 shots per day based on demand. That's about 1.5 to 2 million shots per week, a significant increase over recent capacity of about 40,000 per day. These are ambitious targets, but we will achieve them because no one is better suited to this challenge than Team Ontario. And we are starting from a position of strength, having already ramped up to 127,000 shots yesterday. To hit these new targets, we are urgently setting back up mass vac sites and hospital clinics. More and more pharmacies are coming online every single day. We're expanding pharmacies and grocery retail, workplace clinics for workers, their families, and the supporting community as capacity allows. In fact, we've already started coordinating directly with employers, union leaders, and Chamber of Commerce to execute our province-wide vaccine blitz. To support these efforts, we will soon expand the Stop the Spread business hotline to include an option for businesses to request vaccines for their workers. This will require businesses that demonstrate the ability to safely store and administer vaccines to their staff. But we're looking at every available option to get the shots into arms with no delay. And I need each of you to ask, what can you do to help? I need every business to ask if they can host a clinic or make their facilities available. I need every health professional to ask if they can lend as much time as possible putting needles into arms. And I need every person to ask if they can volunteer at a local clinic, and most importantly, I need you to book your booster as soon as you're able to. Because we know, without a shadow of a doubt, that these vaccines work. and boosters are the best way to prevent the worst. That, my friends, is what we're protecting here. We are guarding our hospitals and ICU to ensure they have the capacity to take care of those who truly need it. We have already taken quick action to protect our most vulnerable in long-term care and retirement homes by increasing testing protocols and implementing strict vaccine requirements for staff and visitors. And we're making millions of rapid tests available to the general public. Today, we launched our holiday testing blitz. We started handing out rapid tests to people in high traffic areas. This includes malls, shopping centers, Christmas markets, and transit hubs. And we're now also adding LCBOs as pickup locations with tests being deployed this week, starting with the top 100 stores and more locations being added from there. That's on top of the 11 million tests we're sending home with students over the holidays. Friends, 50 million rapid tests are allocated and flowing out into our communities. Every test we have is on its way out the door. That's why we continue to urge the federal government to send us as many tests as they're able. We aren't taking anything for granted because while ICU admissions currently remain stable, we do expect those numbers to rise in the coming weeks as Omicron spreads, especially among the unvaccinated. We have hundreds of ICU beds at the ready should we need them and can scale up more as required. We've invested billions of dollars to fortify and increase our hospital capacity to be ready for moments like this. But of course, you can't just have capacity. You need well-trained healthcare professionals available on the front lines. That's why, over the past several months, we've added hundreds more nurses into our system and are working with the College of Nurses of Ontario and other organizations to safely bring foreign-trained healthcare workers online. Friends, there's one more tool in our tool belt: stopping the spread through targeted public health measures. With Omicron spreading so fast, at such an alarming rate, we need to target the largest crowds indoors where people are often unmasked. Effective Saturday, December 18th at 12:01 a.m., any venue with a capacity of 1,000 or more will be capped at 50%. This includes stadiums, concert venues, and large event spaces, among others. I know this will be tough, but it's an important step in ensuring we slow the spread of Omicron as we urgently accelerate boosters. Because as I said earlier, it's all hands on deck. This is a call to arms. And now, more than ever, we need everyone to be doing their part. For some, that will mean helping deliver these shots into Ontarians' arms. But for most, it means simply getting your booster as soon as you can. This is absolutely the best thing you can do to protect yourself and your loved ones. So roll up your sleeves one more time. We've been in this fight for almost 2 years now. We're all tired and wanting this pandemic to be over. Ontarians have made great progress and shown tremendous strength of character, but we're not done, not yet. If we work together, if each of us do our part, we can overcome this as well. It's up to all of us, and I know we will once again rise to the challenge. I want to thank you, and God bless the people of Ontario. We will get through this. Now I'll pass it over to Minister Elliott.
Thank you, Premier, and good afternoon, everyone. Thanks to the efforts of Ontarians, we've come so far in the fight against COVID-19. But as the Premier mentioned, Ontario is facing a new opponent in the Omicron variant. Evidence suggests it's faster, more transmissible, and is changing the trajectory of the pandemic in jurisdictions around the world. While cases were always expected to rise, the increased transmissibility of the Omicron variant could put an additional strain on Ontario's hospital capacity, making it critical that all Ontarians receive their booster dose as soon as possible. That's why, to protect our progress and safeguard the province's hospital and ICU capacity, Ontario is rapidly accelerating its booster dose rollout. Starting Monday, December 20th at 8 a.m., all Ontarians 18 years and older will be eligible to receive their booster dose. Individuals can book an appointment through the provincial booking portal, public health units using their own booking system, participating pharmacies, and primary care settings. Recognizing speed is of the essence, we will also reduce the booster interval for all eligible Ontarians to 84 days after their second dose rather than 6 months. In addition, starting today, individuals aged 50 and older and others currently eligible can rebook their booster dose at an earlier date at the 84-day interval. This is our call for arms and to arms. Please receive your booster dose as soon as you can. If you haven't received your first or second dose of the vaccine, now is the time. The next few weeks will be critical. As the Premier said, we are leaving no stone unturned as we quickly scale up capacity to get shots into arms. We need all hands on deck. The province is working with public health units, hospitals, pharmacists, primary care, paramedics and other healthcare providers to ramp up vaccination sites, as well as redeploy resources to support our efforts to administer every single dose possible. We are also ramping back up workplace and mobile vaccine clinics with the support of our healthcare and corporate partners. Yet again, our partners are stepping up to the challenge, demonstrating the true Ontario spirit. And by next week, we expect our capacity to ramp up to administer up to 200,000 per day based on demand. But that's not all. To provide an additional layer of protection against COVID-19 and variants during the holidays, we've launched a holiday testing blitz as part of our winter testing strategy. Starting today at pop-up locations such as malls, holiday markets, public libraries, and transit hubs, Ontarians will be offered either a take-home rapid test kit or be provided rapid antigen screening on site. Up to 2 million rapid tests will be provided, helping to ensure a safer holiday season. Ontarians can visit ontario.ca/holiday testing to find a pop-up location in their area. Locations and operating hours will be updated weekly, and no appointment will be required. Together with the Chief Medical Officer of Health, our government will continue to take the necessary actions to protect our province against COVID-19 and the Omicron variant and reduce the burden on our hospitals. Please sign up for a booster dose appointment when you are eligible. If you still need your first or second dose, please get vaccinated. And please continue to follow the simple public health measures we know that work so well. Thank you.
Okay, we'll take questions from the floor before we move to the phone lines. Just a reminder, it's one question and one follow-up.
Hi, Premier Ford. Adrian Gabriel with City News.
Adrian.
When it comes to rapid tests,
Yes.
hearing that they're going out into LCBOs across the province, is there a plan in place or is there a plan being worked on for rapid tests to be part of a return to school plan on January 3rd so that students can take a rapid test before they go to school? Because today, parents across the province received emails from school boards saying prepare for a potential closure.
Well, what I can ask you, when it comes to schools, I have all the confidence in the world in Minister Lecce and Dr. Moore. Through consultation with both of them, and the time frame will determine that. As for the testing kits, we sent 11 million tests home for students, not only just for them, but their family of 5-packs. We're going to continue handing out these rapid tests across the country. And I just want to address these rapid tests. And it wasn't you, by the way, but there was a media outlet, and I think we've been getting along pretty well for 2 years. And I just want to clarify something. There was a story that we had 10 to 15 million rapid tests in some closet somewhere. That is false, and they shouldn't be sending inaccurate information. The facts are we've sent out 50 million tests, 30 million from the federal government. We procured 20 million. And the breakdown goes as this. We've sent 45,000 sites. We're burning through 1 million a week. Less than 2 million right now that are allocated for the markets and the blitz. We're getting those out the door. I'm asking the Prime Minister, as I did yesterday, we need more rapid tests. We are down to absolutely zero. I know they're working hard, and we had a great conversation last night with the Prime Minister and the Premiers, and they're doing everything they can. We're working collaboratively with the federal government and all 444 municipalities to make sure that every corner of this province has rapid tests. As it stands right now, we have zero that either aren't out the door or are allocated. I understand millions are coming in on December the 27th. Those are already allocated. We need tens of millions of these rapid tests to make sure that we get them to every corner of this province.
With all due respect, when it comes to schools, though, you didn't answer the question. So if there are going to be more tests coming, is your government, is your medical officer of health looking at putting together a plan for rapid tests on January 3rd so that we can at least try and get kids back into school, considering that they have bared the burden of this pandemic time and time again?
Well, as they go home, we've sent 11 million tests. And when they come back to school, if we have additional tests, and I implore the federal government, and I know they're working hard, to get us as many tests that we can give it to the students. To get tested, we're going to have ongoing testing at the schools. It's absolutely critical. And I think the measures we put in schools are second to none with the leadership of Minister Lecce. And I appreciate what he's done. He's been very proactive, no matter if it's the HEPA filters, making sure that he had 11 million tests out the door, making sure we have nurses across the province. So he's done a spectacular job, in my opinion.
And with that, we'll move to the phone lines for questions.
Your next question comes from Holly McKenzie-Suter with the Canadian Press. Please go ahead.
Hi, Holly.
Hi, question for the Premier and
Yep.
Minister Elliott as well. I mean, it's great to hear that these rapid tests are going to be more available, but what we've actually been hearing from local medical officers and experts is that, you know, with what the Omicron wave is looking at, they are saying they expect they're going to run out of capacity to test all contacts and all cases at a certain point during this wave and probably pretty soon, and they might have to just start telling people to isolate if they can't get a test within 10 days, which is actually already happening in Kingston. So what is the problem with the plan to actually deal with this eventuality? Like, are you planning who is going to get priority for tests and how to ration it? And I guess what's your guidance to public health units and to residents for when that happens?
Well, this is a good question for Dr. Moore. Thank you.
As we prepare for any increase in Omicron across Ontario, we're planning for all eventualities. So as you know, we've built a capacity for over 100,000 PCR tests. Those are the ones that will be prioritized for those with active symptoms, and especially for those in congregate settings, as in a school or corrections facility and or hospital or long-term care setting. So our priority is to maintain PCR capacity for all of those venues. We would use rapid antigen tests at a community level, and we would have public communication to anyone that tests positive using rapid antigen tests and be able to provide them with direct advice. So we're preparing for any increase in cases that could be overwhelming to our current PCR capacity by supplementing with rapid antigen testing.
Follow-up?
Yeah, I'm wondering too about the capacity limits and kind of just doing the indoor entertainment venues. I think some people are wondering why they aren't applying to, you know, restaurants and gatherings as well, given how contagious we know this variant is. And I'm just wondering if there will be another announcement coming on that and whether it will be soon, because the local health experts are saying, you know, if you wait too long, it's going to be too late.
Well, we focused on the largest venues that weren't using masks, and let me be very, very clear. We aren't going to lock down the system and try to get out of this. The best tool that we have, the very best tool, is the folks that are listening today, their friends, their family, get vaccinated. That is our best defense on this. Please go out and get vaccinated. If you're over 50 years of age, we're going to leave that open all the way till Sunday. Starting Monday, we're going to drop it down to 18 years of age. And we're asking every single area in our province, no matter if it's workplaces or hospitals or mass vac centers, pharmacies, every single person, please get vaccinated and ask yourself, what can you do to help Ontarians? What can you do to help Ontario? We showed the world we can vaccinate quicker at greater numbers than anywhere in the world, and that's thanks to the people of Ontario. We need to dig deep again, and we can do it. We have asked the unions to accelerate anything they can do in having their health and safety folks at their facilities to step up and vaccinate people as quickly as possible. We're asking every single person, be it retired firefighters, paramedics, dentists, anyone, please sign up and help us out at these centers. And if you own a business, please ask your team, how can we help Ontarians? And I'll answer that question. Make your facility available. Make your facility available to go in there and get shots in arms. That's how we're going to fight this virus, and we need everyone involved. It's a call to action to every single Ontarian.
Next question.
Your next question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Rob.
Hello, Premier. Hello, everyone. Premier, doctors believe the booster shot gives enough protection from Omicron. So when is Ontario going to change the definition of fully vaccinated for the vaccine passports to be 3 shots instead of the current 2 shots?
I'll pass that to Dr. Moore.
So we'll be reviewing that. We'll be reviewing the full benefit of a third dose strategy across Ontario. We will be following the immunology and benefit of that third dose strategy and make recommendations to government as needed regarding including it as part of the verification certification process.
Follow-up?
Is that, I'm assuming that is something that would have to wait until boosters were given to more people. How long do you think that might be before you could bring it in?
Well, as you heard from the Premier, we have a call to arms right now, and we're building capacity to immunize all Ontarians with the third dose strategy if they come forward. So we'll be monitoring the daily numbers as they come in. Happy to see 120,000 Ontarians getting immunized just yesterday, and want to see those numbers ever increase. We'll be making decisions as we move forward and following the strategy. But I think first you asked for the call to arms, which the Premier is doing today. For all Ontarians to come forward and for all healthcare workers to support this strategy for the next 10 to 14 days minimum, and then we'll review.
Next question.
Your next question comes from Laura Stone with the Globe and Mail. Please go ahead.
Hi, Laura.
Hey, Premier Ford. I wanted you to go through kind of the rationale of speeding up these booster doses. Your government has been asked now for several weeks about this, and you continually said that you essentially weren't prepared to do it. So what changed for you that you realized you had to do this, and can you explain the 3-month rationale now between the second and third shot?
Well, I'll tell you, we're always prepared to do it. We're going to ramp it up like they've never seen before. I just want to remind you, we were one of the first out of the gate when it came to booster shots. We're leading the entire country, bar none. Just to put it in comparison, BC on testing, and this was just a few days ago. I'm sure it ramped up a little bit. With a little over 6 million people, they had about 1.1 million rapid tests. And Quebec, and I'm sure they've ramped it up a little bit since last few days, but they were at 5.5 million with over 8 million people. We have 50 million rapid tests out the door. we're going to continue focusing on rapid tests and booster shots. And we're going to make sure that every corner of this province, there's going to be someone there to give an Ontarian a booster shot. And that's the way out of it. That's as clear as day. But we will perform like we did last time, and we're going to lead the world once again.
Follow-up?
And Premier, I'm struck by your comments earlier when you said, you know, we're not going to lock down out of this. We're not lock down the system to get out of this. Is your government considering any more restrictions? Have you kind of reached the end of your rope here, or do you think it's possible that more could be coming, as you know we've seen today with the sport and entertainment venues?
Well, let me tell you, everything's on the table. I wish I had a crystal ball to tell you where the cases will be in 2 weeks or 3 weeks. All I'm saying, our best defense is get a booster shot. Locking ourselves down out of this isn't the solution. What the solution is making sure everyone goes out and gets a booster shot in every corner of this province. And that's our plan, and that's what we're going to get done.
Next question.
Your next question comes from Loretta Redikoff with CBC. Please go ahead.
Hi, Loretta.
Hi, Premier. Curious, what made you make the decision that the large venues are the ones where you need to limit the capacity, but not the restaurants, when we've heard concerns from some health experts about places like restaurants and bars?
Well, let's be very clear. You got to target the largest venues, and the largest venues are the sports games, large concerts. You know, people aren't masking as much as you know they implore to mask. They all aren't masking. You're sitting side by side for hours. Compared to a restaurant, that's comparing apples and bananas, as far as I'm concerned. Not even apples and oranges. But you know, they have strict protocols in these restaurants, and they've done an incredible job. They're spacing people out, and they're being masked unless you're eating. And there's a big difference between a restaurant and 20,000 people in an arena.
Follow-up?
I've heard suggestions from some health experts. Pardon me, I'm just getting mixed up between all these questions. Talking about that household members of healthcare workers, of long-term care staff, that they should be among those who are prioritized for the booster shots. I don't see that here. Why not?
Yeah, well, we're encouraging all the hospitals, long-term care, congregate living, please give your staff a booster shot. They've done an incredible job. These people are heroes that work around the clock. They're lifesavers. They save lives every single day. They are a priority. And we'll be very clear on the direction through the Minister of Health and Deputy Premier. We'll make it very clear that hospitals, please get your frontline healthcare workers, matter of fact, all your healthcare workers, the third dose as soon as possible.
Last question.
Your final question comes from Colin DeMello with CTV News. Please go ahead.
Hi, Colin.
Hey, good afternoon, Premier. I just wanted to return to the 1,000 threshold limit. You said there's a big difference between, you know, people in a restaurant that might have a smaller capacity and 20,000 people in a sporting venue. But under the changes you're making, there will still be 10,000 people in a lot of sporting venues. So what is the difference in your view between 20,000 people in a sporting venue and 10,000 people? That's still a lot of people, isn't it?
Sure, but there's spacing involved as well, and this would be a good question for Dr. Moore.
Yeah, thank you, Colin. As you're realizing, we're having to change our direction in the face of a new enemy. And Omicron is much more infectious, and there is a potential that it can spread in the air. And large venues like that can be mass gathering threats of spread. And as a result, we wanted to increase the ventilation, or decrease the total number of people in those venues, and have greater oversight of mask wearing in those venues. So as the Premier said, we don't want to close, but we want to limit or decrease the risk in those venues. And Omicron is a definite game changer. We have to try to decrease the risk of rapid spread in those environments. As you've been hearing from me yesterday, it spreads 4 to 8 times more rapidly than Delta. And as a response, this government has put in play, as of today, very proactive measures to try to decrease the limit of spread of this virus at a dangerous time.
Follow-up?
Thank you. My follow-up is actually for Dr. Moore. Dr. Moore, there's been a lot of talk about whether COVID-19 is spread via droplets, via close contact, or whether COVID-19 is airborne. You said a second ago there's potential that it can spread in the air. So are you once and for all acknowledging that COVID-19 is airborne?
Yeah, no, you're hearing very much my concerns about this strain of Omicron, that we're very concerned that there could be much more aerosol spread than other strains. We always assumed that there was a component of spread, but because it's so much more rapidly spreading than Delta, we want to decrease the number of people in those high access areas. And as the Premier has said, one of our key components of the strategy is to get your booster dose, because immunity does wane after, we think now, 3 months, and a booster dose should further protect Ontarians, and that's why that time frame's in there. As well, we all have to wear our masks and practice our distancing and do a good hand hygiene. It's a multi-component strategy that all Ontarians are used to, that we need to absolutely adhere to in the face of Omicron, because I do think the risk is higher that it spreads more distantly and in smaller droplets. We need more science on that, but we're taking a very cautious approach in Ontario, and we're reviewing all best practices in our hospitals, long-term care sectors, and other areas as we speak, to best protect the workers, but also to best protect Ontarians.
Thanks, everyone.